Hi, this is Dr. Saad at Healing Aesthetics, Hinsdale, Illinois. Today, I want to talk about one of the most common concerns that my patients report, the 11's. Those vertical wrinkles or lines or grooves between the eyebrows. Very stubborn. Of course, first line of treatment for these lines are neurotoxins, like Dysport, Botox, all those. But sometimes, even when we completely relax this muscle, those lines won't go away. They become permanent. So what are the treatment options for these deep and stubborn lines? Filling them with fillers like hyaluronic acid fillers may sound like a good idea, but it's a very dangerous area to put fillers in. If the filler goes inside an artery, it can cause vascular complications like skin necrosis, like blindness. This area has major arteries that we want to avoid fillers in. This doesn't apply to Botox or Dysport. Here, this is not a problem to put Botox or Dysport because even if the neurotoxin goes inside the artery, it will not occlude it. The problem here is only with fillers. So other option will be PDO threads. I personally like to place threads here because the thread will fill the gap, will fill this depression, and eventually when the body absorbs it completely, it will replace it with collagen. So PDO threads are the same material that we use in surgeries. When we do a surgery and leave the suture inside the body absorbs it completely. When we place the thread here in the 11 or around the eye, or even in areas with acne scars, it initially filled this area. And then after the body absorbs these threads, collagen will form in its place. Today, I'm going to show you two cases. I used PDO threads to treat the lines between the eyebrows. In one case, I choose to use a twist thread, which gives more volume. And in another case, I choose to use smooth thread. This is our first patient. As you can see, this lady has lines and wrinkles in the glabellar area, forehead, and crow's feet. After discussing different treatment options with the patient, we decided to place 4 smooth threads in the glabellar area and treat her with neurotoxin, like Botox or Dysport. And then make her come back for follow-up in 4 weeks to assess the improvement in the glabellar lines. She will get more threads with each neurotoxin treatment to help building nice collagen in the treatment area. I'm expecting nice results for this patient. This is our second patient. He received neurotoxin treatment in the glabellar area, but his glabellar line is really deep and need to be filled. So we decided to insert 1 twist thread under this groove to support and fill it. And we had amazing results. We'll share the picture with you at the end of this video. Before the procedure, we numb the patient with numbing cream to make sure the procedure is comfortable with minimal or no pain. It's also very important to disinfect the treatment area 1 and 2 and 3 times. This is a procedure where we leave a thread under the skin. It's like an implant. We definitely don't want to transfer germs from the surface of the skin to the deep tissues. Very important to have a clean field. Now we are inserting the smooth threads in the treatment area in the correct plane. Those threads come loaded on needles and they are sterile and ready to use. We pass the needle with the thread under the skin, leave the thread there, and pull the needle out. These threads can be placed adjacent to each other or to form like a mesh or any design based on the patient needs. And as I said before, these threads will be absorbed by the body and leave new collagen behind. Viewers may feel that this procedure is very painful. Actually, it's not. Needles are small and sharp, and insertion is fast. Many times we can place these threads with no anesthesia at all, but we use numbing cream for extra comfort for the patient. This lady was very comfortable during the entire procedure, and right after we finished, she was ready to go back to her normal daily routine with zero downtime. In this patient, we used one twist thread. Twist thread add more volume to the treatment area with higher ability to fill deep grooves like this one compared to the smooth threads. This is the picture of the patient before the procedure. You can see how deep is the glabellar line. And this is his picture right after the procedure. Immediate, amazing results. The groove was filled, and it will continue to get better when the collagen is built in this area. I hope you enjoyed the video today. Hopefully we'll meet again in a new video and a new procedure.